All right, welcome back to ABA exam review on our fifth BCBA practice exam. We're going through the next 10 questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Be sure to check out behavioranalyststudy.com for all of our study materials, including our practice exams and our famous combo pack. As always, when you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. 61. A child is referred to a math tutor to work on their addition and subtraction of one-digit numbers. The child is able to complete 5 easy math problems. The tutor asks the student to complete 5 days of an online assessment so that the tutor can gather baseline. At the end of the 5 days of baseline, the student was able to complete 8 easy math problems. Now, there's no question prompt. That's okay. Let's just break down the question and then go from there. Okay. So essentially, if there's no prompt, we just need to figure out what happened in the question. And we know, based on the information given, that this child was referred to a math tutor and they could complete 5 easy math problems. Then the tutor asked them to complete an online assessment for baseline. At the end of baseline, the student can complete 8 math problems. So what do we know? In simple terms, before baseline, the student was completing 5 problems. After baseline, they were completing 8 problems. Now, if you know your vocabulary very well, there's a very specific term for this. If not, let's work through our answer choices and see what we can come up with. Ideally, as you get better and better at the exam, you should be starting to predict answer choices before you get to the answers. Because remember, we're doing all our work in the question. So, A, tutor's intervention was effective. Has the tutor started an intervention? Well, no, he's collecting baseline. The tutor hasn't taught the child anything. He's just given them an online assessment for baseline. There is no intervention going on. B, a practice effect occurred. What's a practice effect? A practice effect is an increase in skill as a result of multiple attempts in baseline. So this looks exactly like what a practice effect would be. C, inadvertent reinforcement increased the behavior. There doesn't seem to be any inadvertent reinforcement. We're not sure why the behavior increased or what's maintaining that. All we know is prior to baseline attempts, they did 5. After baseline attempts, they were doing 8. And then D, the baseline procedure was poorly designed. It might not have been, right? There's nothing indicating it was a poor baseline design. We just know in skills like math, which are hard to, 1, reverse, and 2, can be learned quickly through sometimes repetition, that if you're giving them attempts in baseline, it's not uncommon for that baseline to increase. So what most likely occurred was a simple practice effect. 62. Massed practice and applied behavior analysis treatment is most commonly tied to what other intervention? Massed practice throws off a lot of people because a lot of times they lump it in with our other punishment contingencies. And what's different about massed practice is where it kind of fits into our ecosystem of treatment. So what makes massed practice different than, let's say, positive and negative practice? Well, there's one key thing. So what is it tied to? A, negative reinforcement contingencies. Well, it's not a reinforcement procedure, all right, because you're going to be implementing or you're going to be doing the same thing, incorrect response over and over again in order to reduce that behavior. B, self-management packages. Yes, mass practice is most commonly tied to self-management, and that's what throws people off. It is not a positive practice over correction procedure. It's a negative practice over correction procedure. So it's most commonly tied to a self-management package because mass practice is just an overcorrection procedure to use in self-management. That's the big distinction. So massed practice and applied behavior analysis is most commonly tied to self-management packages. Marco asks his friend to help him quit smoking. Marco's friend tells him that each time he feels like he wants to smoke, Marco should make a note in his phone and pop himself with a rubber band. Marco's friend is possibly suggesting what? So Marco's friend is suggesting what? And this is important because we're looking at Marco's friend's suggestion, not necessarily Marco, okay, even though we're going to look at Marco's behavior as well. And that's important on the exam because in a lot of questions, there'll be multiple people, multiple learners, multiple behaviors. You always want to pinpoint exactly what you're looking for and who you're looking at. So we know Marco's friend, okay, told Marco that when he wants to smoke, make a note and pop himself with a rubber band. So essentially, Marco's friend is having Marco monitor himself for smoking. So A, self-monitoring, looks great. Now, let's keep going. We don't just stop at the first answer choice we like. We always read all of our answer choices. So B, self-evaluation. Well, Marco is not evaluating himself against anything else, right? He's simply monitoring, okay, and actually providing himself a little punishment for smoking. So C, habit reversal. Now, self-monitoring is directly related to habit reversal, as in self-monitoring is a part of habit reversal. Habit reversal is a multiple-step, empirically proven way to change habits through self-management. And part of habit reversal is the self-monitoring step, where you're identifying and becoming aware of your behavior. And that's exactly what Marco is doing. So Marco's friend is not only suggesting self-monitoring, he's also suggesting habit reversal, even if unintentionally. By proxy, self-monitoring is directly related to habit reversal. He's working to reverse Marco's habit of quitting. So Marco's friend is possibly suggesting both A and C. 64. A toddler is sitting in her high chair and eating lunch with her mom. The toddler will sometimes hit her head against the back of the high chair and laugh. When she does this, the mom looks away, but then immediately smiles and re-engages when the toddler is not hitting their head. What type of procedure is the mom using? The very specific giveaway in this type of question, right? So we know it's a differential reinforcement question, okay? Because some behaviors are, a target behavior is extinct, I should say, and then we're reinforcing other things. And one of the keys is we're not reinforcing anything specifically, meaning we're not teaching a replacement here. We're reinforcing when? We're reinforcing in the absence of a behavior, right? The mom looks away when she's hitting her head, but smiles and re-engages when the toddler is not hitting their head. So in the absence of hitting the head, the mom is delivering reinforcement. And we're not specifying any other behavior that we're trying to increase. This is simply a decrease, right? A decrease of a behavior. And what differential reinforcement procedure focuses on the absence of a behavior? That's the question you need to ask yourself. So A, differential reinforcement of alternative behaviors. Why can we eliminate this one? Well, because we're not teaching a replacement, right? We're reinforcing for a behavior not happening, okay? So we're not teaching a specific replacement. Alternative is out. What about differential reinforcement of other behaviors? Yes, that's what we're looking for. DRO focuses on the absence of a behavior. When we're reinforcing the toddler for not hitting their head, okay, the most common example for DRO is probably screaming. Kids who scream constantly. Whenever they're not screaming, they get reinforced. It doesn't matter what they're doing, all right? And that's a basic way to put it, but it doesn't matter what they're doing. As long as they're not screaming, reinforcement is being delivered, okay? DRO. C, differential reinforcement of lower rates and differential reinforcement of diminishing behavior. C and D are very similar, okay? There's slight differences, but either way, okay, you're working to reduce behavior, but on a set criterion, right? Slowly but surely, okay? And there's different ways lower rates and diminishing all vary, okay? But at the end of the day, with lower rates and diminishing, you're slowly and systematically decreasing behavior. With DRO, you're trying to get rid of the behavior entirely, right? The behavior, when it's not occurring, right, is being reinforced for not occurring. When it is, it's always on extinction. So the main takeaway is if you are reinforcing in the absence of a behavior 100% of that time, you're looking for a differential reinforcement of other behaviors. 65. A behavior analyst reaches out to a former client for a testimonial to use in their new advertising campaign. Former client happily agrees to provide the testimonial. 3 months later, the former client reaches out to the analyst for a referral to a speech therapist in the area. What should be done with this testimonial? Well, be careful here, right? First, is it okay for this former client to give a testimonial to the behavior analyst? Sure, they're a former client. As long as the analyst uses a disclaimer, they're totally fine, okay? Now, 3 months later, that former client reaches out to the analyst for a referral. So this is where it becomes tricky. Is this referral, how does that change their relationship? So A, What should be done? A, nothing. The testimonial was given when the client was not receiving services. Yeah, so far it's okay. Just because they're giving a referral, that doesn't change the relationship. They're still a former client. A referral does not make this former client a current client. B, add a disclaimer to the testimonial regarding the new relationship. Well, the relationship hasn't changed. The analyst is simply referring them to a different therapist. Now, if that speech therapist happens to work at the same company, that's a different story, because then they become a current client. C, remove the testimonial as the client is no longer a former client, but is now a current client. Again, not true. They're not a current client. They're still a former client. The analyst has simply given them a referral, right? And so you can keep that testimonial as long as they don't become a current client. And then D, update the testimonial to reflect the new status of the relationship. Again, not a change in status. It's simple referral. If that speech therapist happens to work at this company or they happen to collaborate with this analyst, things might change. But as of right now, the relationship has not changed. The testimonial is okay to stay where it's at. 66. Diana is practicing for an upcoming concert where she will be playing the violin. She learns a song and plays it at a perfect volume and speed, but she must know how to play the song standing up for the concert. What type of shaping should take place? Let's think about two main types of shaping, because we're clearly not changing the function, right? Shaping across topographies and shaping within. The best way to think about this is when you're shaping within topographies, think about you're changing the magnitude, right? You need something to happen faster, slower, louder, softer. You're changing the magnitude of that topography, not necessarily how it looks, but just the magnitude of what's taking place. What we're doing here is we need that topography to change. We can't be sitting and playing the violin. She needs to play that song standing up for the concert. So we need to shape this behavior to where it's occurring standing up, which is a pretty significant change in topography, right? So if we're changing topography that much and standing up is not a magnitude, we're going to be shaping across topographies. So again, just think about if I'm shaping within, I'm looking at magnitude. Slow, fast, loud, soft, these type of things, right? If I'm shaping across, I'm changing a significant part of the form or how that behavior looks. 67. If you were planning to implement a differential reinforcement procedure, what would reduce the effectiveness of your differential reinforcement procedure to the greatest extent? Let's think about differential reinforcement. We have a target behavior, and sometimes we have a replacement behavior. But either way, certain behaviors are being reinforced and the other ones are being extinct, right? So if we think of just a basic DRA, okay, we are putting the target behavior on extinction and we're reinforcing the replacement. Now, if you're going to implement this differential reinforcement procedure, what's going to reduce the effectiveness of that procedure to the greatest extent? A, if the target replacement behavior was not in the client's repertoire. Absolutely. One of the main criteria before you can start differential reinforcement of, say, an alternative behavior is that replacement behavior needs to be in the repertoire. You're not teaching the replacement behavior at the same time as you're doing differential reinforcement. They must already have that behavior in that repertoire. B, if it was difficult to ignore the client's behavior. Well, remember, ignoring and extinction, not exactly the same thing. Planned ignoring can be a method of extinction, but extinction is not synonymous with ignoring, and we can't confuse the two. C, if the client had only, if the client was only reinforced by a small number of items, well, even if they're reinforced by a small number of items, we can still deliver reinforcement, and it's not going to hinder it more than A. And then D, if the client wasn't old enough to understand they were being differentially reinforced. Does somebody need to know they're being reinforced? No, that's automaticity, right? So the primary issue or thing that would reduce the effectiveness of a differential reinforcement procedure is that the target replacement behavior was not in the client's repertoire. That is the problem. If you don't have a replacement behavior in the repertoire, what are you teaching? What are you reinforcing? And again, just go back to B, we can't make extinction and extinction and ignore synonymous. They're not the same thing. Planned ignoring is a strategy, but not all extinction is ignoring, right? We don't just ignore the behavior. There's other ways to do extinction. Extinction is withholding reinforcement. It is not ignoring, okay? It's a very important thing that as analysts, you need to teach your technicians because it's probably one of the most misunderstood ideas in ABA. 68, Travis likes Pokemon cards, so his behavior technician gives him a Pokemon card each time Travis engages with another adult for more than 5 minutes. The supervisor on Travis's case tells the technician to extend the required time to 15 minutes. Afterwards, Travis stops interacting with adults, but still requests Pokemon cards. What most likely occurred? What do we think occurred here? Okay, it doesn't seem like too much has changed, right? Travis likes Pokemon cards. He gets a card each time he engages with an adult for 5 minutes. And then the supervisor says, well, let's extend the time to 15 minutes. After that, Travis stops interacting with adults, but still requests Pokemon cards. So he still wants the Pokemon cards. He's just not engaging in the response to gain them. Why do we think that happened? A, satiation. Well, he's not satiated. He's still requesting Pokemon cards, so he clearly still wants the reward. B, ratio strain. Yeah, this looks like a clear example of ratio strain, and this is a question you might have been able to predict. If we increase the requirement from 5 to 15 minutes, that's a big jump. 10 minutes is a long, long time. So Travis, even though he still wants the cards, is not willing to work for 15 minutes. We've thinned it too quickly. There is strain. C, extinction. Well, the behavior isn't on extinction. Okay, he's not even doing the response, right? And then D, behavior contrast. Behavior contrast hasn't occurred because we're still in the same setting. So afterwards, after Travis stopped interacting with adults, what probably happened was ratio strain. Too much fading too quickly, responses too requirement is too high, just not willing to work for it anymore. A kindergarten teacher is teaching her class how to identify letters. The target letter is written in green on the board, and the other letters are written in black. Once the kids can identify the green letter, the teacher starts to write it in black as well. The teacher is doing what? All right, so what is the teacher doing? And clearly looks like she's fading a prompt. Simply, right? Because she has the target letter written in green. Others are in black, so we're changing the stimulus. Once they can identify the green letter, what does she do? Well, she starts to write it in black as well. She's faded that green out. If we look at our answer choices, fading a prompt is not in there, right? We have adding an intrusive prompt, but she's not adding anything more intrusive. She's removing a prompt. She's not punishing student behavior. We're not talking about reinforcement. She's not thinning anything. What is she trying to do? Well, she's trying to transfer control from the green letter to the black letter. She's trying to transfer stimulus control from one thing to the next. And when you think prompt fading, it's essentially stimulus transfer control. And that's a lot of times how I teach it to RBTs. And as BCBAs, you need to know it on a more deeper level than that, right? Because behavior can come under stimulus control of certain things in the environment, and we need it under control of other things. It's that we'll use a stimulus control transfer procedure. But when you're fading prompts, that's essentially what you're doing. You're going from the green SD to the black SD. So the teacher is doing what? Well, she's doing a stimulus transfer control procedure. Which of the following best describes a hero procedure? What is a hero procedure? Well, this is simply a vocabulary word question, right? So kind of easy, but some questions will be easy on the exam. We can't overthink them. We know a hero procedure is a group contingency, right? And it's a dependent group contingency. Remember, we have a independent contingency where it's just you gain reinforcement if you do it, right? You're relying on yourself. We have interdependent where you're reliant on the whole group. And then we have a dependent or a hero procedure where you're reliant on one person or a small group. So a hero procedure is A, learner receives reinforcement on their last possible attempt. No, that's not a group contingency. B, the last procedure you try before transferring the client to another provider. No, not a group contingency. C, a reward is contingent on one person or a small group engaging in the target response. Yes, this is what we're looking for, right? This is a hero procedure. And then D, a reward is contingent on engaging in the target response, regardless of if anyone else engages in the response. That would be an independent contingency, where you're looking for a hero procedure or a dependent contingency. So C. Thank you for watching. As always, behavioranalyststudy.com. Like, subscribe. Let us know when you pass. Work hard, study hard. See you soon.